And then let me go down and it says we're live on Facebook, so I guess we're live on Facebook, huh? Welcome, everyone. Thank you so much for joining us this evening. This is really my pleasure. We have so many people here, doctors, professionals. I'm going to love this conversation. I don't know how many of you had a chance to watch Black Men in White Coats film by Dr. Dale. It was a phenomenal film. After this discussion, you may want to see it or see it again if you haven't seen it. So I will give you access link to it a little bit later on. But it is my pleasure to have 7 wonderful African-American doctors ranging from all categories, from everywhere. We're going to talk about the film. We're going to talk about experiences as Black doctors. We're going to talk about why, and this is something that I just learned recently, that only 2% African-American doctors of all doctors. How is that? Only 2% are African-American. So we're going to talk about that. I don't know if they know why, but they're going to talk about how they rose to the top to get to where they are. My very special guest is Dr. Herman Gray, and he has the answers to all of this, don't you, Dr. Gray?
Just call me Gramps. Yeah.
You know what? I respect you. I regard you highly. People that are in the Michigan area, the nation or whatever, your name should have come into their mind in some area because you've done a little bit of everything around. And I'd like to welcome you as well as all of our other young doctors who gave me permission to call them by their first name. But I will grant you the respect of Dr. Gray that you so deserve of calling you Dr. Gray. Thank you so much for being with us this evening.
My pleasure.
All right, let's start right away because we don't have a whole lot of time. It doesn't seem like much to me. Only 2% African-American male doctors in the country. What do I ask you first? What's going on with that? Say something about it to get us going.
Well, I would just like to start to say that, in our class, in our medical school class of 160, there are only 4 Black males, and 2 of them were my brother and I here.
Right.
And so, I remember walking in on the first day, and you don't really see a whole lot of people that look like you. And so, almost immediately, I think my eyes darted to any African-American males that I actually saw, which were only 2 other ones besides my brother, of course. And, that feeling, especially on your first day, is pretty overwhelming. It's you definitely feel a little bit out of your comfort zone for sure. And you do start to think a lot more about what are you really getting into. I would probably say that throughout all of this, I have had the benefit of having, my brother with me by my side, literally. And I attribute a lot of that to being able to make it through all of this challenges every step of the way.
Mm-hmm.
And
I want to say you're not seeing double. I should have started in the beginning. I'm going to have each doctor introduce themselves. Well, you know what? I'm going out of order just because you spoke first, either Jeremy or Jermaine. Who was that?
That was me. I'm Jeremy.
Don't say me. I'm going to start at the top. I guess it's the same way in everyone's box as mine. Let's start with Dr. Herman Gray. Please introduce yourself. Tell me about the kind of doctor you are, have been, what you're doing right now. Let's start there.
Thank you, Gil. Herman Gray. I'm a pediatrician by training, and I'm the one that raises the average age on the group here by 20 years or so. I am a native Detroiter. Went to all public schools, K through 12, Wayne State and University of Michigan for undergraduate, University of Michigan Medical School, trained at the Children's Hospital of Michigan as a resident in pediatrics, residency meaning where you do your specialty training. And I've had a lot of opportunities in my professional career and things that I've done. And most recently, currently I'm the chairman of the Department of Pediatrics at Wayne State University's Medical School. Prior to that, I was the CEO of the United Way for Southeast Michigan. And prior to that, I was the president of the Children's Hospital that I trained in for almost 9 years.
I love this. Why do I feel like I'm going to be emotional? Just to know it's 2%. And I feel like I have 1% right here, don't I almost? Carl, tell us who you are, doctor.
Yeah, so my name is Carl. I'm originally from Ann Arbor. I am, like Dr. Gray, a pediatrician, but I'm subspecialized. So I am what we call a neonatologist slash perinatalogist, meaning I take care of and specialize in handling the critical care of the premature infant all the way up to about age of 1. Although here at the Children's Hospital of Michigan, we like to do things slightly differently. So I have some kids slightly older than that. But that's a little bit about me. I, like Dr. Gray, went to U of M. I went to Michigan State for medical school. So I have never left the state of Michigan. And, it's just been a state that's been good to me. I even met my wife here and all that stuff too. So.
Very good. Dr. Randall, tell us about you. Uh-oh.
He's muted.
It doesn't show that you're muted, but I don't hear you. So let's try it again. I want to hear everything.
Can you hear me now?
Yes, I can. Yes.
Yeah. Okay.
It's a little echoey, but I can hear you.
All right. That's Dr. Randall McPherson. Born and raised in Kalamazoo, Michigan. Then I attended Michigan State University for my undergraduate degree. Then I went to Wayne State School of Medicine, where I graduated from medical school. Then I did a family medicine residency here in Detroit at Detroit Medical Center / Sinai Grace, and currently practicing in the Metro Detroit area, and doing family medicine / geriatric medicine.
Very good. Next doctor, we have Donald.
Welcome, everyone. My name is Dr. Chinemelu, Donald Okoye. I go by ML informally, Donald formally. I was born and raised in New York, specifically the city. I attended undergrad in Harlem over at City College of New York. I, from there, went to medical school in Brooklyn, over in the SUNY Downstate Medical Center. From there, I went and did my residency in Detroit. And I did my residency in internal medicine and pediatrics, which is a dual program. I since completed that and actually returned back to New York. So as right now, I'm studying for 2 of my boards. We have to take 2. Kind of working on an organization that some of my fellows here are actually a part of, in community engagement. And as of today, just kind of talked to dealing with a QHC, which is the Federally Qualified Health Center. So part-time, trying to keep myself a little loose, not doing too much. And see, I'm failing.
Very good. Dr. Gini.
Hello, good evening, everyone. My name is Dr. Gini Ikwuezunma. I'm the eldest of 5 kids. I'm from Atlanta, Georgia, but currently residing in Tennessee. I'm currently an obstetrician gynecologist resident at Meharry. But we also have some opportunities to rotate in various places in Detroit. So I'm rotating in Detroit, Sinai Grace. So I've come to love my Sinai Grace family, and it connected me to some of my colleagues here who we are doing a little bit of outreach with some of the COVID-19 with an organization that we, several of them are a part of. But I'm happy to be here, happy to answer questions, and thank you so much for inviting us to participate, Ms. Anderson.
Absolutely. And Jeremy.
Yeah, so I'm Dr. Jeremy Hockstrom. I'm a 2nd-year internal medicine resident with the Authority Health Internal Medicine Program here in Detroit. Originally born and raised in Chattanooga, Tennessee, and did undergraduate studies at the University of Tennessee at Chattanooga, and then went on to medical school at VCOM Auburn, which is in Auburn, Alabama. And I have my twin brother here. We're both here today. Probably similar story. Dr. Jermaine Hogstrom here, and pretty much everything he said. Went to the same undergrad, same med school, and also 2nd year for internal medicine.
Very good. Thank you so much for being here. And as I did mention when we first started, we're talking about a film, Black Men in White Coats was a film, and that was by Dr. Dale. I do have some books here. Can you see? It's a book. We have a few books at the end of the program that we are going to raffle off. So for those of you who are attending through Zoom, you are eligible to participate in the raffle. I'd ask that you type your first name and last initial to Jalen in the chat, and you will be included in the raffle at the end. So we have a couple of books by him, How to Be a Doc, How to Raise a Doctor. And then if you have children or know of children, Doc to Doc. We have a few of these children's books also written by Dr. Dale. So once again, type your first name and last initial in the chat under Jalen Anderson, and she will include you in the raffle at the end. Okay, now let's go back to talking. The 2% doctors. I know I heard from you, Jeremy. I want to talk about some of the things why this has occurred. And I want to talk to Dr. Gray first with this one. What's going on here with only 2% African-American physicians now? What has happened and how does it differ from when you were beginning doctor practice?
I was an intern. I graduated from medical school in 1976. And was an intern in July of 1976. And I was one of African-American male physicians in my internship class. There were two other African-American males in the entire training program, the 3 years of pediatrics, in about 62 doctors. Things haven't changed very much at all, quite frankly. The number of African-American males who are applying to medical school, who are being accepted to medical school, has been fairly stagnant over decades of time. In the last few years, there's been a little blip upward, but time will tell whether it's sustainable or in real or increases. And like most questions about race, it's complicated, but it's a function of poor K through 12 elementary school and high school education. Foundation is important when you talk about going into a field like medicine. It's hard to catch up if you decide to become a doctor somewhere after high school, because there's lots of planning and discipline that take place in getting to the point of even being able to apply for medical school. And of course there is systemic racism. The deck is stacked against Black people in general and Black males in particular. So, example, school to prison pipeline. There are schools all across America that have no tolerance policies for oftentimes behaviors that used to be considered normal childhood behaviors. It is very clear from the data that Black children are disproportionately treated differently, either expelled or suspended from school more frequently. We have police in our schools now, and issues that that used to be when I was in elementary, junior high school, and high school would be handled within the school, are now handled oftentimes by the legal system. We see 9-year-old little girls being put in the back of police cars or being handcuffed. I mean, so the environment is still fairly oppressive for Black people to be successful. Clearly, Black people are successful and are doing all kinds of things, but this is a discipline that requires not only good training and a strong education and background, but tremendous self-discipline and planning, pre-planning. What are your next steps? To try to get from high school to college, what college you should go to, how do you get into medical school? And frequently we don't have people to tell us sort of the insider baseball kind of stories about, so how does that work? We often don't have that. Of this group here, the vast majority of us, were first generation physicians. My dad was a surgeon, but my dad was also an immigrant from Jamaica, in a country that was run, largely by Black people. And he came to the States to go to medical school, and met my mother, a Georgia peach living in Valdosta. He met her when she was a receptionist in the doctor's office here in Detroit. And so there's poverty, single parent households. All these things make it much more challenging for smart Black children, as the vast majority of them are, to reach this kind of career.
Very good.
Yeah.
You said so much there. I want to talk about what was your determination, young doctors, young physicians. What was your determination to even start medical school and then continue through? Who will take that? Do I
So
just call
I
Randall?
think I'll take that. All right, you can take it. Go ahead.
Okay. Yeah. I mean, I think most, but I know for me, again, I'm Gini. Speaking to some of the things that were just mentioned, I come from an immigrant background. I think that was fueled a lot of my desire to really become a physician, seeing substandard, healthcare in not only my community here in the States, but then also traveling to Nigeria. I actually spent some time across the globe. I've done a lot of global outreach. I've gone to Uganda, Kenya, spent a year in Jamaica. And so just seeing that kind of what people do with less, and seeing the opportunity that I have to kind of help bridge that gap through an ability to communicate with patients and people that we come into contact with that look like me. That has been my continual drive, all about the patients. But, it all started with my family upbringing, and that seeing my dad come from a different country and, his value for education, that really fueled my desire to go further.
I
Carol?
would say, oh,
Okay, no, whoever was going to speak, I think Carol was you the one? Were you
No,
the one?
I had started to, but if Randy wants to
ahead,
go, he can
Carl.
go.
Okay,
Go
it
ahead,
doesn't
Carl.
matter.
Okay.
You're both
No,
going to
so
talk. Mhm.
so I guess to answer your question directly, what sparked my drive to do this? It's actually an interesting story, given that we talked about, Dr. Gray specifically talked about race. So I'm gonna do something that will make a little more sense. So I was sitting in my pediatrician's office, and I was a kid that had tons of ear infections. There's way more information than you need to know, but it's kind of relevant. So I kept getting, this, otoscope that all of us know and have used shoved in my ear, and I hated it because it always hurt, because my ear was always hurting. So the doctor's asking me for the millionth time to let me look, and I flat looked at him and said, no. And my mom said, you got to let him look because you need the medicine, and stop being, a little baby, and, the things that parents say to get you to do it. Right. And I'm not throwing my mom under the bus, but suffice it to say, I needed to be coaxed. I am, but I needed to be coaxed into doing it. And admittedly, I was being a baby. So the doctor looks at me, and he's a white man, and a man that I really, really respect and love. Dr. Alan Dumont, my childhood pediatrician, says to me, hey, Carl, how about if you let me look in your ear, I'll let you look in mine. And I looked at him and said, are you nuts? You're going to hand me this device that you just shoved in my ear and let me look in yours? He was like, yeah. And I'm like, but how am I supposed to know what I'm looking at? And he looks to his right. He says, I have this model. So you're going to see everything in this model, and I'll walk you through it. Now, he says this to me, the elementary school kid, and he got my full and undivided attention. I'm like, you crazy enough to let me have this toy? I'm going to play with the toy. So he looks in my ear, and I go through the rigmarole of crying and not really liking it. And then I proceed to look in his ear. And this man meticulously walked me through the bits and pieces of the inner ear. And I was hooked. I said to him that day, I want to be just like you when I get older. And he said to me every single time I went, so what are you doing to be like me? Are you still getting good grades? Do you still want to go to school? Have you changed your mind? And honestly, the fact that he kept bringing it up and it kept being fueled, I think was part of the first portion of the drive to get me to want to do this, because he was the first person that showed me that doing it was cool. And he actually showed it to me in a way that I could relate to.
Love that. Randy, I never do want to say something on that. I want to ask a question. I'm going to come right to you in just a minute, Randy. I want to know, does it take just the motivation and encouragement from anyone, no matter the race, or is it true what they say, you can't be what you don't see? So think about that question.
That's why I said what I said, because I think that on some level and on a large level, there is a lot of truth to that statement. But that's why I wanted to shout out that particular person, and I used his name specifically because I think sometimes when you hear the encouragement coming from a place you didn't expect it, it lands in a way that's more powerful sometimes than when it comes from the people who you might think are saying it just because they want to give you a boost. Because this man did not have to let me A, look in his ear, and he B, did not have to make the statement after I told him I wanted to do this. Not only could I do it, but then encouraging me to do it.
Randy, I'd like to hear from you.
So I would say what drove me is, I mean, my family support. I mean, I was always, you know, the smart kid in the class. I always got the highest grades, but you know, my family always, you know, encouraged me to, you know, be the best I can be, including my mother, aunts, uncles, even some friends, some older friends, but my real exposure to medicine, I would say, is in high school. I was fortunate enough I grew up in Collinsville, Michigan, where the KPS school system isn't, I would say, as lacking of resources as I would say as maybe some of the Detroit public schools, which is where I'm currently residing now. And we had a program called Education for Employment, where they took high school students who were interested in the medical field, whether it was nursing, whether it was PA, physician, and I think it was once a week we went to the actual hospital and we got to do, I mean, we did things like CPR classes, we did vitals. And I think that right there kind of geared me towards, and actually one of the instructors at that program was, you know, they gave us quizzes too. And I always got the highest score. And he kind of told me, hey, have you ever really considered going into medicine or becoming a physician? And at that point, I kind of talked about it here or there, but it didn't really hit me until that point. It's like, wait, no, I haven't, but I do enjoy what I'm doing. I do like what I'm seeing. I do like interacting with, you know, patients. So yes, I believe I can do this. So that kind of sparked me to just keep persevering. I just have a persevering, I would say, aura about myself. I don't give up. I don't quit, and I just push through whatever I can, you know, whatever obstacles and barriers that I'm faced with. So that and that right there was kind of like driving me, just like, you know, you can do it. You can do it. Even when I got to undergrad, when I got to medical school, I had some little bumps in medical school, but you know, I had great role models, everyone, you know, to push me forward, help me, encourage me, and you know, I was able to matriculate through. But I would say that mine's probably started in high school, but I've always, ever since I was younger, always just had this, you know, this persevering personality.
Yeah. Who else didn't I hear from on that? Jeremy, you talking?
Yes. I just want to say, you know, for me, definitely encouragement came in a lot of different forms. Growing up, from our mom, you know, growing up, I remember as far as, it had been at least first grade, second grade, she was always asking my brother and I, you know, so when you grow up, what do you want to do? And it always started off as well, I really don't know. I have no idea what I want to do. But kind of as the years progressed, you know, it was always like on the car ride coming home, you know, she was always asking, what do you want to do? What, you know, have you ever thought that about what you might want to go into when you grow up? And again, you know, still, I don't know. But eventually, as you kind of see, you know, I think growing up, kind of the world around you as like a kid, and I know on our mom's side of the family, you know, a lot of her family are living in more of like the rural parts of Mississippi, which of course, you know, as you know, access to healthcare isn't the best. And so kind of seeing that growing up, I feel like really, you know, at a young age made me drive to want to do something to be, you know, make a change in that direction. Then on our dad's side, he's from Liberia, West Africa. And so, you know, he is immigrant from, you know, abroad. You know, growing up, he always kind of told us the story about how, you know, he came over with like literally a suitcase and not really much, you know, cash to his name at the time, coming over to go to college and things like that. New to America, new to everything here. And, you know, he's over the years told us that story. And the one thing that I gained from that was, you know, that he's come here to give us an opportunity. You know, I've always kind of think back retrospectively, like, you know, he's come here because he wanted to make an opportunity better for him and better for his family, better for his kids. And kind of along the way, as I've kind of continued to think about that, I'm thinking, well, gee, you know, if I was in his position and if I made, you know, the brave decision to kind of come over here completely by myself, you know, I wouldn't want to kind of let him down in that way. I would want him to know that coming over here and, you know, making those decisions, making those sacrifices, was all worth it. So there's that aspect to it that, you know, I think has partly really driven me. And then along the way, I would say I've been very fortunate to have a lot of teachers and professors in college that were really, you know, pushing for my brother and I to really go for what we wanted to achieve. And, you know, it wasn't easy, but I can definitely tell you now that without that support and encouragement along the way, it probably wouldn't have happened at all, because it was really a big factor.
Yeah, and I just kind of wanted to add. So yeah, kind of, you know, similar to what he was saying, you know, even just growing up, I know I never really had in the back of my mind what I wanted to do specifically. However, our mom, she worked as an occupational therapist, and our dad was, you know, and he still is, you know, big into public broadcasting. So, you know, they always kind of pushed us to kind of become whatever we wanted to be. But although, you know, so we are first generation doctors in our family. So we didn't necessarily have, you know, a prime example of what that path would look like and how we can get there. However, because our parents always pushed us to be, you know, something great or be what we want to be, they were always encouraging. And, you know, they never would say, oh, you know, we should be doctors. So it was kind of a decision that we kind of ultimately made on our own. And interestingly enough, we kind of made it at different times too. But I really attribute us getting to where we are through their hard efforts and really, you know, pushing us to pursue education. So
Very good. Dr. Gray, I know I heard in the film, did I get everyone on that or did I miss somebody?
I think I'm the last one to answer.
I'm sorry, Donald. Come on.
Draggy. I think my motivations, my reasoning for getting into that, into my role now, it's sort of along the lines of what Gini had mentioned. Being from the sort of the household that we're from, West African parents. My parents, both of them immigrated from Nigeria, and more than 30 years ago, and they had instilled education as a preeminent thing as far as for livelihood. That we need to make sure that we achieve the best that we could in academics. So it was in the water. There was never, I kind of knew, I mean, if you know Nigerian parents, West African parents, for any Nigerians out there, people who know them, I mean, you know, the category that was just set for us, you know, physician, lawyer, engineer, doctor, lawyer, engineer. I mean, it's broad, but the idea is that they focus you on the idea of higher institution, of higher levels. And so it was always instilled in me that early I was going to be a doctor, but it was never really, oh, it was this particular point, like, okay, this is what triggered it. It was just, I'm going to be a doctor, and it was never the end all be all. I always knew, okay, but I'm going to do that. That's a thing that can be done. And that really, again, is, I think, formed from my environment. I knew it was something that could be done, but then I also said, oh, but I'm also going to be an author. I'm also going to be a scientist. I'm also going to be a rapper. I had all these things in my mind, and I mean, you know, some of those fell off.
Can you rap, Donald?
Rap career is still budding, you know.
I was about to put you on the spot.
I want to hear it.
A little laugh now, but it's something. I had multiple passions, but I knew that being a physician was a passion as well. But I didn't take it to be the role. I didn't see it as unattainable, but I saw it as a set of skills that I needed, because I knew my purpose, or principle, at least the thing that I thought was important for me, was to take these skills and apply it to my family, my community as a whole. And that's something that, again, was bred into my household. It was really like, it's all about the community and what you can do for them, and looking back for people behind you. And so that was really my motivation. Just being a doctor was just akin. It was just the highest. I guess my proclivity was towards that. I was aligned towards it, but it could have really been anything else.
Mm-hmm. Love to hear the determination. Dr. Gray, I want to talk about something they mentioned in the film that most people dismissed from the residency programs are African American. Do you know about that, or can you speak on that, or why do you think that's the case?
Yeah, as I recall, the number was something like 20% of all people who got expelled from training programs, residency or fellowships, and those are specialty training programs, are people of color. While people of color don't come anywhere close to representing 20% of all the trainees in America. So they're disproportionately kicked out. I have professional experience with this. One of my previous lives, I was associate dean for graduate medical education at the Detroit Medical Center and Wayne's Medical School, which meant that I oversaw the 1,000 or so trainees at the medical center. And if a program, the federal rules, the governing organizations for training programs requires that if a trainee is going to be put out of a program, that the designated institutional official, which was the technical name for my job, is required to investigate and determine whether or not they were treated fairly and to make sure that they had appeal rights and that sort of thing. So I am told about a trainee in a vascular surgery program at the Detroit Medical Center. And I get all the records and I'm puzzled because every evaluation is really quite positive. The nurses that work in the OR, we actually did interviews, loved this guy, and talked about how well he did and how well he got along with both the staff and the nursing staff and the other physicians. We interviewed fellow trainees in the program who all respected him and thought that he had a good fund of knowledge. This was in year 6 of this gentleman's post-medical school training. He was within 6 months of graduating and becoming an official licensed vascular surgeon. And the training program director decided that he did not meet his expectations and he kicked him out. So after the investigation, I go and have a conversation with the program director to try to understand what happened, because clearly it's not documented. And if it's not documented, it probably also means that it wasn't discussed with the trainee. And the program director's response was something to the tune, something to the effect of, I don't have to tell you anything. It's my program. I don't want him here, and he's got to get out. And so then we had, a more difficult conversation. Well, actually, it's not your program, sir. You are the program director for that, but it is not your program. It's a Detroit Medical Center and Wayne State program, and they get to decide what happens to this trainee. And you haven't given any, please share with me if there's something that is severe enough to stop someone who has done 5 years of general surgery and is now in his second year of vascular surgery training, and now you decide that he's no longer, oh yeah, he was also a pharmacist before he went to medical school. So now you're telling me that he's not good enough. You got to give me more than what you've given me thus far. And this guy just absolutely refused to talk about it any longer. So I had to tell the dean of the medical school that we had apparently a program director that was rogue and that was maltreating our trainees. The dean of the medical school was uncomfortable about it, but wasn't really willing to do anything. I refused to sign off on it. And we ended up having to find a spot. I personally called training programs around Detroit. We found him a spot in another vascular surgery program in Toledo, Ohio, and the Detroit Medical Center paid for him to go there to complete his last 6 months of his training. This happens in America, and it isn't commonplace, but it explains how you get that 20% or those large disproportionate numbers of people who are treated perhaps unfairly. I'm not saying that all of them are treated unfairly. There are, perhaps some bad doctors in there, and we are obliged to identify bad doctors, because, I don't want a bad doctor treating my children or my wife or my grandmother any more than anyone else does. But the vast majority of people who get kicked out of training programs are not dangerous. They've stumbled along the way somewhere. A few have psychological difficulties, a few have personality disorders. If I had not been in that position, that young man would not be a vascular surgeon today who is practicing, in the state of New York. It's a great concern for me. And so that's at one stage in my career. Early in my career, heck, it wasn't even in my career. I was a pre-med student at the University of Michigan, and I was just finishing up my second year of training or of education as a pre-med student. And I went to see my pre-med counselor to discuss year 3. And he had my file in front of him, and he, transcripts. And I come in and say, "Hey, how you doing?" He says, "Hey, good." We chit chat for a minute, and then he says, "Okay, so why are you here?" I said, just planning, my schedule for next year, as a pre-med student. And he looked at me and he said, "Oh, you're never going to get into medical school. Forget about it." I said, "Well, I'm sorry, what did you say?" He said, "It's not going to happen for you. You should consider being a physical therapist or maybe a dental hygienist. If you want to stay in healthcare, those would be perfectly fine, good, careers for you." This was termed in the film, and it was referring to younger children, in the film, I believe, but it's the same thing, and that is the soft bigotry of low expectations. There is any number of people who even unconsciously just look at us and do not see excellence, do not see life-saving treatments, do not see groundbreaking research. They just see a black or brown face.
Yeah, that's really something. I'd like each one or whoever has something to speak on that, an experience that you've had pertaining to racism throughout.
So what Dr. Gray said, it's funny he said it, and I would imagine that if I asked or you asked each of the panelists, all of us unanimously share a story where we have all heard that very same thing. I heard it in the same spot. He heard it in college, where I sat across from a guidance counselor, and I was actually a freshman. So this is the worst place for this to happen. And this counselor told me that not only would I never be a doctor, I should consider doing something else. And she flat used the term, I was not smart enough. Now, I say all this to say, because Randy or Dr. McPherson made the statement, and I think this is another thing that every one of us share, that in order to get to anywhere, we won't even talk about being a physician, in order to get to anywhere of substance in this life, you have to have a degree of what I like to call hopeful hard-headedness. The thing that most parents try to take out of you, that most of us all have, and you learn to basically manage, where effectively someone looks at you and says what you're not, and you just don't believe them. You refuse to believe them, because all of us up here have been told that we weren't able to do something, couldn't do something, weren't good enough at something, but yet all of us kept going, and we kept going because A, we're hard-headed. As Randy said, we don't quit. And a lot of it is an aspect of, I'm going to prove you wrong. So each of us has a competitive streak that none of us are really talking about directly. But I think that's the difference that separates sometimes the people who are successful and able to make it, a little bit of luck and just a little bit of, I tried maybe one more time than someone else. Because I tell patients all the time, because I've had patients look at me and say, well, I would love to be you, but I'm not smart enough. And my response is, I'm not smarter than you. Because many people think that in order to get to these seats, we're smarter than the other person. And I would tell you bluntly, that is not true. A lot of it is just grit, hard work, and just not giving up. It's doing what people are not willing to do, the staying up late, the me chasing around, someone else to get another piece of information, the me just not taking no for an answer. Okay, you told me I can't do it. Let me go find another counselor. That next counselor says no, let me go find another counselor. Well, if you all saying no, I guess I just don't have a counselor. I'll just do it myself. and I mean, it's funny, but this is kind of how we all get here, because on some level, if society as a whole says that you are not going to be a thing, and you listen, which is what happens, and it's unfortunately starts early. If you believe it early, you don't ever make it to the position where you can try one more time. And I think that's the biggest thing that most of us see. And it's the unfortunate thing that has led us to the place where we don't have any of us here, because many brown kids are told, as the film pointed out, when you're in first grade, hey, why don't you go be LeBron James? Why don't you go be Jerry Rice, Barry Sanders? I mean, it's a shame that you have first graders who say they want to do the things, across the all races, but then by the time they get to third and fourth and fifth grade, mythically all the, brown people want to be athletes and everyone else wants to do something else. So if you don't have parents like, Don or the other people we're talking about, where they flat tell you, you should be something great and you should pursue an education, why would you do something different than what the majority of society says that you are geared to do and are good at? And you have constant examples of being good at in the public eye, because that's what we glorify.
You touched a lot of things, Dr. Tabb, and I see in the chat someone says it looks like you all were blessed with a good support system, and that's great. Any tips for those who do not have such a strong support system from families or friends or their teachers? Who can say
Well, it certainly
something?
is a blessing to have a strong family standing behind you. After my encounter with that pre-med counselor, I went home that weekend, to Detroit, and my mother raised my sister and I pretty much by herself. Our parents got divorced when I was 12 or 13 years old, and my dad went back to Jamaica. He just really wanted to be back home. I told my mother what happened reluctantly, because all I could think of was how disappointed she was going to be and my father was going to be that I was not going to be a doctor. And my mother was a high school graduate, and that was it. So it doesn't take having another doctor in the family or a PhD, but she understood the value of education, and all 4'11", 99 pounds of her looked at me and said, "So you're going to let somebody else determine your future?" That's all she said. And I reflected on it. I had a pity party for maybe the remainder of the weekend, and then as Randall has suggested, as Carl has suggested, it was like, I'll be damned if somebody's going to stop me from doing this. This is just not going to happen. And I have said many times that I wasn't necessarily the smartest kid in my medical school class, or in my pre-med classes, or in my high school. I know that for a fact. But I was certainly one of the most hard-headed and stubborn and persistent. And there was no obstacle that could not be changed into an opportunity ultimately. It may be painful, it may take longer than you want, but if you want it badly enough, and this is not criticizing people who don't have an opportunity to do this, because it's complicated, but I think what you are hearing and seeing that all of us have in common, and other than Carl and Randall, I haven't met the other doctors, is that that characteristic. It's a discipline also. It's a specialty. It's a profession that also requires tremendous discipline. The combination of persistence and discipline, and the ability to deny self-gratification. I can't go to that party. I got to stay home and study. That kind of discipline sometimes is lacking in some young people because they've not seen any examples of it.
Mm-hmm. Can anyone else? Yes.
Yeah, this is Gini. What Dr. Gray, I want to impress upon some of the things that Dr. Gray really said, because that persistence, and then looking at that point in time from those first to third grade years, if you're the type of child that has grown up in an environment where you don't really see what deferred gratification looks like. You see Michael Jordan, or you see, the big rappers that have the fancy cars. It's extremely difficult when you come from an area where you have of abject poverty, or a place where the social pressures are like, oh, you got to get those new Jordans, you got to get the starter jacket, you got to get this, you got to get the new, the new PlayStation. Those things can make it particularly difficult for young children at a young age to put those things aside when everybody's telling you to do that. So you've got to have that foundation. You've got to have that village around you, whether it be small or large, like Dr. Gray was saying. But I think too, as Randall or Dr. McPherson mentioned, having that grit, and Carl mentioned having that grit, there's some type of internal fire within you that says, I'm not going to stop. I'm not going to, lay down for what these people are saying that my career is going to be. I had that same experience where I had the high school guidance counselor. My area was a suburb of Atlanta, and it was a county school. I went up in public schools, and I remember going to the guidance counselor. I had A's. I was I played football and all sports throughout. Went to the guidance counselor. I said, I'm interested in going to med school. I want to do pre-med. And I remember reading his assessment. He's something of the, this is a guidance counselor, and he said something about not necessarily being smart enough, but he works hard. And I remember, as a high schooler, junior high, hearing that kind of assessment. I'd probably met this guy like all of 2 or 3 times. And, I remember going home and feeling very defeated for a moment, but then feeling anger. And that, I still remember this this day. And that kind of pushed me along as I went every step, just to kind of make sure that I did not, fulfill that prophecy that person had said in my life. So I think that's particularly important.
Mm-hmm.
Yeah, I'll just add to that. So many gems were dropped in there. I want to try to reference everyone appropriately, but the perseverance is so key, is so important. Being kind of dedicated to the task, developing discipline to carry you forward, it's so important. There's so much that's required for us to get into this position and stay in this position. From me, my personal experiences, and I'm sure everyone on this panel can speak to it. It's a trouble. It's such a big issue just getting into this conveyor belt, just getting into the system, and then it's such a problem just trying to stay in there. Every stage of the way, I've been in some way discouraged or attempted to be or dismissed, or it's some form of barrier was placed in front of me. I'll just be brief with some of my stories, and I'll try to specifically answer that question about what can be done. But when I wanted to go into, just getting into, once I got into medical school, I'm not talking of the difficulties getting into medical school, but it was made much easier for me, or made tangible for me, because while in undergrad, just speaking of my transition into med school, and while in undergrad, I was able to connect to a pipeline program that essentially ensured my matriculation into a medical school as long as I met certain criteria. I have to have good grades. I have to have a decent GPA. I have to have a good MCAT score, which is the entry exam for medical school. And I have to meet certain requirements, which were a sort of a specific tasks that were required for this program, extra education, extra learning, to help to try to build me up. That was so essential and key. That was called the Early Medical Education Program, EME, and that was in City College, New York. And they had multiple types of it in different colleges in my area. There are many types of programs similar to that are available. I strongly encourage that everyone, if they're available, look for that opportunity. Find the right people who can kind of plug you into those opportunities. But that helped me to make it a tangible goal. Of course, looking back, there was plenty of opportunities that I could have taken, on my medical school journey, looking in different areas. But I was so hungry for that assurance, because it was a lack of self-confidence to a certain extent, and that really helped to boost me. So that really was a great support for me. And this is not something that my parents knew much of. So it was something that I had to go and look for myself. So that's one thing I did. And once I got into medical school, I was looking to try to get into residency. I was kind of stuck with what I wanted to do. And I knew I wanted to have a component of children. I know I wanted to do internal medicine, but I just didn't know how to separate and which one to go for. And then I found out internal medicine pediatrics, that program was a thing. Never crossed my mind. I had to do my own research. I went to my guidance counselor to try to say, okay, I want to go into these programs. How do I go about it? Completely discouraged me the entire time. One, well, you know, they're people who go in there usually just pick one specialty anyways. You know, they only go one route. It's really hard to get in, you know, grades wise. So I don't know if that's going to be right for you. It's not the best thing because in this area, it's you know, not many people going. So I completely dismissed her. I look for people who dismissed that person, and I look for people who had gone into those programs. I got as much information as I could, and I did my own. I just kind of moved to myself, and I eventually, thank God, you know, matched into an internal medicine program. You know, if I just had really listened to that person and had them, you know, fill me with those type of negativities, I would have probably been dissuaded off my path. But I continued forward while in MedPeds, which is a shortened version of the internal medicine pediatric program. I mean, there's been situations, you know, where everyone's trying to build and become a better physician, and there's no one that's not trying to work hard. And I was an absolute hard worker. I was so, you know, meticulous because I was very concerned that, you know, people looked at me as not being, you know, effective, not being efficient, you know, not being on par with my colleagues. And so I put a lot of pressure on myself. I went and studied. I took off a lot of, you know, personal days that I put towards just preparing myself, take a lot of long nights, lack of sleep, really just to make myself, you know, more capable. And, you know, it added so much stress. And so when I get these issues where it says, oh, well, you're not doing, you know, you're not there, you're kind of lacking, it really hurts you. You know, it hurts you as a person. It makes you feel, what else can I do? You know, I remember going into one of my rotations. I won't get into the details of it. It was a 1 month rotation. In the first week, they were talking about I should redo this particular program, this rotation. Within the first week, and it wasn't even at the end of the week. It was after the second or third day, because of an oversight where a patient was supposedly brought to from transition from one level of care to another level of care. This was in one of the ICUs. And it was just mentioned, oh yeah, this patient's going to be on the floor now, or on this station now. It was never made clear to me, because it's not something that I would like dismiss. It was never made clear that, okay, yeah, I should take care of this patient. I'm just new. I'm trying to like follow and figure out what everyone's doing. It was just like, yeah, this patient's on. It wasn't even like directly to me. It was like, this patient's on the floor now, and because I'm you know, I had no idea. So I kind of go about my day. The next day, I'm told, well, you were just completely negligent. You didn't do what you were supposed to do. You didn't kind of talk to anybody about these details. And I'm like, I was never told. And so, long story short, I mean, I was so scared that I was going to have to redo this whole thing after a couple of days, because I was formally sat down and I had to sign a document saying, you know, I agree to these terms. And I said, I don't. I want to show you that this is not, you know, I'm a great physician. And thankfully, I was given an opportunity, because I wouldn't sign. After a week's passed, I come back and it's, oh, well, you're amazing. You're actually really good. You know, you work really hard. You're good with your material. And so it's like that, something so small like that, the type of scrutiny that's put on you. And I do believe it was because of race. Because honestly, it shouldn't have been any other detail or reason because I do my job. You know, I try to do it as effectively as possible. And so it's like every step of the way you find some type of barrier, but I find that finding people, mentors, finding friends, people you can relate to and talk with, that helps you along the way. So that's my story, and that's really what I've been doing as far as support.
Yeah, I'd like to make it clear that medicine is difficult. It's hard. It's supposed to be hard. It should be hard. Every one of us, wants only the best for our own loved ones. You don't want somebody who is unprepared and not ready to be taking care of other humans. That's a given. There are still many things that have happened during the lives of, Black physicians, male or female, and certainly for males, however, that go above and beyond anything that has to do with excellence and any objective evaluation of skills. And I would just make a couple observations. One, these, these common thread stories of pre-med counselors or high school guidance counselors who are telling, young Black children about what they can or cannot be. Just think of the irony of that, whether they're a Black counselor or a white or a Chinese, I mean, it doesn't make any difference what they look like. They're advising, they're crushing children's dreams, early on in their lives before they have a chance to even fully blossom. And the irony, even further is, of course, that none of them are doctors. Right. As I've thought about my pre-med counselor for 40 friggin' years. And I have almost no regrets in my life, except that I can't even remember that sucker's name, because I would find him today if I could, and just share. I wouldn't even have to say anything. Yeah. Here is my CV, sucker. Tell me that I'm not ready for medical school. What's wrong with you? And so it's not their job to try to dissuade people from doing things. It's their job to help them figure out how to find for themselves what their destiny should be. One. Two, this notion of persistence is, it can't be emphasized enough. And this is in our DNA. We are the survivors of those who made it on those ships over here. We are the people who would not die, in the Middle Passage. I mean, our brothers and sisters got tossed overboard. Some of them voluntarily jumped overboard. We are the remainders that went through slavery and Jim Crow, and we are still here, and you could not crush us. That's where it comes from. There's no mystery to me where it comes from. It is innate in who we are, the ancestors of. And that is, I reflect on my own dad, and I'll stop talking after this. My dad went to medical school in Boston. He could not live in Boston. Boston is not known as a city, particularly back in the 40s and 50s, as a city that was particularly welcoming to people of color. So he had an apartment in New York City. He worked as a dishwasher in New York City, and he commuted back and forth on the train every day, and he slept and studied on the train. That's what he did to get through medical school. And then when he became a full-fledged physician, he could only practice in Black hospitals. He could not get on the medical staff of the Detroit Medical Center, where his son was the president of one of those hospitals. He could not even get on the medical staff. And so that's the word of encouragement as well in that message, is that if you are persistent, if you're hard-headed, if you're determined, you can do lots of things, and you can make your dreams come true if you are willing to sacrifice and work hard for them. And the fact that we no longer have segregated medical staffs or segregated hospitals where the Black patients or the brown patients are on one medical ward and the white patients are on another. That's the way my own children's hospital was organized, when I was a child. Things are getting better. They're just not getting better fast enough and quickly enough. And this country is becoming more and more diverse, not less diverse, more and more diverse. And if it doesn't figure out how to bring equity to the table for every profession, including healthcare, the health of our country is going to suffer tremendously.
I like what you said, Dr. Gray, things are getting better. I will hold on to that. I would like to ask, how do you make things happen when the people in power won't let it happen? Can anyone speak on that? What do you do? That's the mystery question, if anyone could have the answer to. When people tell you no, people knock you down. You try and break barriers to make things better in the medical field and otherwise, but the people in power, and I think that was somewhat mentioned in the film as well, the higher powers block all of it. Any recommendations? You can have the multi-million-dollar answer to that.
I think the irony in it is, and this will speak to what Dr. Gray just said, when you have been the group that was stuck on a ship, dragged over to a different country than you were, and we'll just put it out there, you were kings and queens in the country you were dragged from. You come over to this country, you fight through that. Then you're told you're not good enough and that you should only do this one particular thing. And you look at the example of that thing that they're telling you and pointing you to. And historically, we're great at that. Then you look at, okay, so I was great enough to come over here. I survived the transition. I then was told that I needed to be an athlete. I survived that. So I'm really great. Everything that I do, I'm great at. Everything that someone looks like me, where a bunch of us are doing it, we're great at it. So all I got to do is find a way to make it so what I'm doing, I look and find just even one more person who looks like me. And then maybe when that one person that looks like me gets another person, we can be great at that too. Because I know you don't want me to do it, because if we all do it together, we're known to be great at everything that we start doing. And when you start playing that game, you can go from being the only person in the room where you're the number one or the only person, and you look up the next year, wait, there's two of us. Then the next year, oh, wait, there's three of us. Or you start playing the, oh, well, it's just one black male, but oh, look, I got a sister over there. Or you look and you say, I'm in a hospital and I'm the only person in the hospital, but all the cleaning staff look like me. And what most people don't know is all of us physicians of color know most of the people in this hospital frontwards and backwards. And the people that we know that work in this hospital who clean, who most people ignore, none of us do. And you'd be surprised when we walk around here, and I can testify, I have had awful days. And I have had one of the cleaning staff people walk up to me and pick me up in ways that I couldn't even begin to thank them for.
Man, you, yes.
You can relate, huh, Dr. McPherson?
You struck a chord, Carl.
Yes, yes. You'd be surprised, man. We all done mid residency, man. It's hard, it's rough. Like Dr. Gray said, it's supposed to be hard. But yes, I that struck a chord, because I've had, it's still to this day at Sinai, some of the cleaners, the police officers, just walk up, hey brother, you look tired. Hey, I just want to let you know I'm proud of you. And you this make my day just talking to you, man. Seeing that white coat on you, seeing that stethoscope on you, seeing you rounding with the attending and you presenting. He's like, you got it, man. I know it's rough. I know you're tired. You probably worked a 20, 36 hour shift. Hang in there, man. He's like, we rooting for you. Mm-hmm. We've gotten that message because, like Carl said, because we are the ones who talk to them, and we're relatable. And because of that, we get that extra encouragement from them. And little do they know that it's sometimes all I need. Just that one, oh yeah, okay, let me dust it off. I'm back. Let me get back. But no, that one struck a nerve.
I can tell, yeah.
I've had many of those. And to this day, I mean, if I could pop in Sinai, I speak to them, yeah, they're good people. So
I know some parents are listening in right now, and they maybe want their children to pursue a field in medicine, but they're not really sure. You hear, oh, that's hard. You can't be a doctor. It's easier to be a football player, which I don't know how they make that, because it is not easy to be a football player. If I had to choose, what would I pick, right? So what is it? Say something to parents. What can they say to their children, or you inspire the parent as to how they can inspire their child? Anyone who can do that.
So I'll say this quickly, and then I'll let someone else talk. I have had the unique pleasure, and I'll just drop this bomb. I played collegiate football. I actually sat in the Detroit Lions facility and tried out for the Detroit Lions. On my first day of tryouts, and I'll leave the year and all the other stuff nameless, folks can look it up if they're interested.
Look it up now.
There was a statement that was made that I have never forgotten. Because I was sitting in the room, the statement was made, welcome to the Detroit Lions facility. I just want to let you guys know that if you make our practice squad, you will make more than 90% of the doctors. And I remember hearing that statement when I was sitting there like, that's an interesting statement. So then I was like, whipped out my phone, was like, what does the practice squad have to do? Like, seems like a lot of money. So then I looked, I was like, oh, you don't even have to work that long? Wow, that's pretty amazing. I say all this to say, when you're told that you can only be an athlete, I did both. Mm-hmm. I made the conscious decision to do what I'm doing now because when we talk about support system, I have two phenomenal parents who told me to be thoughtful about what you do tomorrow. So I was thinking about how I could provide for a family in the future. And I knew that if I was going to play football, my dad always said that it wasn't for that long. Because the running joke about the NFL is it's not for long. So I knew if I did it, it was only going to be for a few years. And I always went into it with what's my plan B? So I would say telling your child not to play sports, that's not necessarily the move, because sports taught me a lot of discipline and gave me a lot of skills that I wouldn't have gotten otherwise. But I was always told, in order for you to play sports, like one of the people in the video said, you gotta have good grades. Like you won't even get to play unless you got good grades. And then B, what's your plan B? Doctor, lawyer, teacher, whatever it is, you take that to the max, take it all the way to the end, never let someone tell you no, and just take the skills from each thing and apply it to the next thing. And there is nothing that you can't do.
Yes.
Yeah, I'm gonna speak on that as well too. Yeah, Carl, I actually played football in undergrad too at UGA, University of Georgia. I walked on, was a wide receiver. Me, like all my brothers and I, we played sports, like I mentioned, all throughout. So I walked on at University of Georgia, and I've had that experience playing at that higher level, not quite like yourself, like at the NFL level, but again, a lot of the discipline that you learn when you're going through medical school, there's so much of that I learned from the field that translated, like getting up early. I remember getting up tired, like having to do 2-a-day practices in the summer. You're going in the morning for these things we call mat drills. We wake up 5 in. Some of my counterparts weren't doing any sciences. After that practice, I was up in the bio lab looking at film, same kind of discipline you have, looking at film and looking at practice stuff, looking at your routes or running through your routes. I was looking at like over the slides of, things in the biology lab. A lot of my counterparts, their day was done when we left practice. Mine was just beginning, or I needed to get up early in the morning so that, when I was taking some of those harder biochemistry classes, that kind of discipline, the same thing that I learned on the field, kind of carried me and like allowed me to be successful in those courses. And, that perseverance as well, not giving up on a play, those same things you learn in sports. So I wouldn't deter your children from playing team sports. Team sports it's important because you learn a lot of intangible and tangible lessons that can carry through life, especially in this day and age where there's a lot more focus on social media and different ways that kids are interacting virtually, especially during this pandemic. But I would encourage you to try to foster both of those things, but allow them, like Carl said, to have that plan B. What are you gonna do when this portion of your career doesn't pan out? There was probably about 4 or 5 of us that were in undergrad that were playing sports, and a few of those guys were biology majors, and they've gone on and to be successful. So I would encourage you to foster both if you can.
Yeah, I completely agree with that. Like, growing up, I kind of think about the things that have driven me. And I've actually been asked this similar question by a parent before about, how do I get my kids to be able to, achieve a lot in things? And my response was exactly the same that you all have said. It's finding, getting your kid into something that they want to be great at. And similar thing, growing up, I remember one of our friends was in a Taekwondo. This was like probably elementary school. And they were taking Taekwondo had been in it for like a few months, but we went just to pick them up. We went with their mom just to pick them up. And for example, I saw that what they were doing, and I kind of really enjoyed what they were doing. And, and thus got into doing Taekwondo as well. But one thing that I always remembered wanting, telling myself is that, I just really want to be really good at this. I really want to be really good at Taekwondo. Okay. And I did. I became fairly good at it, eventually got a black belt. And I was like, wow, if I actually kind of thought back, like I actually like really did this. It's kind of crazy. Then as we went on into like, the middle school, I picked up piano and things like that. And at first, honestly, I didn't even care about playing piano at all. Like I wasn't even about it. And but our dad was one that kind of got us into it. And but I, not that he forced us, but I had planned on actually just kind of stopping. But for some reason, I just really wanted to be good at playing the piano, and so I kind of stuck with it. And it was the same kind of like drive that I find in myself to today, at wanting just to be good at something, wanting to be good at what I do, and nobody's going to tell me no. And that transitioned on to high school. Growing up, played tennis a lot. Yep. And at some point, I was looking at a lot of the greats in tennis, like you have Serena Williams, you have Venus Williams, you have Arthur Ashe, and all of those figures. And at some point I was literally telling myself, man, I really want to be like them and want to go professional and wanting to like do this. And so I found myself really driving to always practice. Like, remember, my brother and I would go out and practice like 5 hours in one session because we just really wanted to be good. And we just had that drive that, again, nobody was going to tell us no. And I found myself to this day, honestly attributing a lot of the values that I've learned and that he's learned, to not letting anybody tell me no in the academic world. And it does translate directly. And so sports and a lot of those other activities are very important to that. So whether you're into dance, whether you're a young dancer, I don't care whether it's hip hop, ballet, whatever the case. Our younger sister, she does a lot of dance and especially ballet and things. And we're always encouraging her. We're always telling her, hey, you want to be good at this, keep practicing hard and be good at it, because it's going to be that same drive that's going to drive them in the future in their careers. And they're going to have that confidence. That's the biggest thing, is that drive leads to confidence. You build your confidence in one skill, and you build your skill up in one area. That leads to confidence to want to attack another area. And that's what I found, really driving me as a whole, and not only in medicine, but just in my life in general. Yeah. And one thing I wanted to add is that, so I remember this very, very clearly. I think it was like a very first semester of undergrad. And I kind of say this because one thing I believe in, especially for parents, is that in order for your kids to succeed, you have to set a bar for them. And I say this because we had this professor that really kind of took us under his wing when we expressed to him our desire to go to med school. And this was our very first semester of undergrad. And I remember he specifically told us that, this journey will not be easy for you, but I'm going to push you, and I want you to take my classes, and I'm not going to be easy on you. And I remember kind of thinking on that very day, I was like, okay, what did we just get ourselves into? Because now we have someone that is going to expect us to really perform, and now we can't fail. Right. And I haven't even got started yet. Right. And so, kind of starting from there, I think that really pushed us to want to do our best for ourselves, and then kind of be able to provide the example along the way for others. And I recall one very specific thing, one very popular question that people would used to ask us is, what if we don't get into med school? And what was our response? It would always be, well, we don't really have a backup plan, so I guess it's the only option we have, because this is what we want to do. Yep. And some years later, and here we are. So I really feel that for parents, it really starts with setting a bar first.
One thing I noticed hearing from most of the doctors, you talk about drive, persistence, determination. I think even Carl, you mentioned stubborn. If you have a child that falls into those categories, don't be discouraged, because you hear the doctors now, it takes a little bit of that, or a lot of bit of that, a little stubborn. If you think your kid is just, it's just the way you steer it and channel it, and look at the successes here. I haven't heard anyone saying, oh, you have to be a little weak, or you have to be, it takes some if you don't know what else to call it, to kind of help you get through this day. Dr. Gray, I see you.
Yeah, no, I was just reflecting on my years as a practicing, pediatrician, and before I got more into the administrative, aspects of healthcare, and this is a question that came up a lot, with in a Black pediatric practice, parents worry that their sons are, hanging out with the wrong people, or they're worried that they're not taking their studies seriously enough. And being a parent, is there's a lot of it, it's a faith walk. You're looking at somebody who is the unfinished product, and you have no guarantee or assurance of what it's going to look like when it matures, 25 or 26 years later. But you have faith that if you, as Dr. Hogstrom, said, set the bar high, in a loving, caring, gentle but firm way. You're not going to beat your kid because they don't get all A's, but you're going to encourage them, particularly if you know they're capable of getting all A's, you're going to encourage them to reach for that. You're going to, try to teach them resilience, that life isn't always, smooth sailing. In fact, life is never smooth sailing, and that there will be disappointments and failures, and that you have to brush yourself off and get back up, and that includes the career path that we have chosen. There's a lot of falling down and brushing yourself off, in all kinds of ways, and so to encourage parents that if they are in a loving home, whether it has two parents or one parent in it, that they set rational limits for their children in terms of what time they need to be home, what the expectations are for school, treating others kindly and well. The things that we learn from our parents, the vast majority of us, are still pretty doggone smart. And while they don't guarantee success, they come pretty close to guaranteeing. It's not a parent's job to determine what their child does. That's got to be their passion. That's got to be their dream. They have to follow that. But it is a parent's, job to make sure that their child has enough self-confidence in a world that is, particularly for Black children, or brown children, in a world that is constantly sort of beating them down, beating them up, telling them that they're nothing special, telling them that nobody cares about them, telling them all kinds of negative, sort of messages. It is extremely important to make sure that they know that, they have everything that they need right now to be successful. There's nothing else that they have that they need except for what they have. Their God-given gifts right now is all they need to be successful, and that you have unwavering faith in them, even when they do something extraordinarily, unbelievably stupid, as they almost always will do. That you are, committed to them, and that you are a safe place for them. That when they are afraid, when they are self-doubting, that they can come to you and share that with you, or at least not expect you to beat them up over it. And so there's parent, I don't think anyone on this screen would be where we are right now without what our parents' expectations were that they set for us and the care that they gave us. And it works. It is real. And you just can't see it if you're a young parent, because you gotta travel on the journey.
I want to actually
think, sure.
one point, and everyone's given their rationale. I think mine is a little different. That's why I wanted to speak on it. But just extending off of what Dr. Gray just said about being in an environment where Black and brown children are really being beaten down by the imagery, by the things that are in front of us. Just as much as they need to be encouraged, the parents themselves need to also be reassured that this is a path that can actually be accomplished and secured. So I really want to push this in a more of a communal, because it is a communal effort. So I want to diffuse the responsibility. I think us as physicians, we want, for us individuals, African-American males, Black individuals who've been able to get to this level, we need to make ourselves more visible. I think it's the problem with this statement when I make it, it kind of shifts the responsibility of all these societal issues, the disparities that occur, all these inappropriate actions, interactions. It kind of shifts the responsibility onto us. And it shouldn't be. I just want to make it clear, I'm aware, but it shouldn't be. But at the end of the day, we need to kind of do what we can to subvert this type of system. The best way to do that is to reassure these parents that there are people like us by making ourselves more visible. If they need to know that there's a possibility that their child can be in the health and become a physician, or they can be in an orchestra and still be a physician, or they can special do dance and still be a physician. I mean, they need to see the variety of options within that in that spectrum. And since we embody that, we do need to make it our part to go out and show it. We don't. I mean, there are levels to how active you become, but I think visibility is the very minimum that we should kind of submit to. And I say this because I mean, I would hope I find like a basketball player, a physician. I found some I have not personally interacted with, but I want to be able to be that. I'm trying to find my end. Even going back from when I was very young, my physician end. And so I'm kind of reassessing my skills right now and seeing what is it that I can promote that can really be something that inspires the children or individuals behind me. It's crazy because I can think of countless interactions with female colleagues and during my medical career studies who basically envisioned themselves becoming a doctor because they envisioned the outfit that they would wear in the clinic. Like they just they knew that. They had the stethoscope, the white coat. They knew the type of shoes they were going to wear, the color. Like that was enough to make them want to do that. And I feel like there are so many in colleagues who we all know on the panel who are style ambassadors for the doctors of the doctor degree. And I think we should be ambassadors in all sense of the word to allow people to see that this is not some confining space, where that is impossible to get into. But we are very diverse. We have multiple facets to us, and you are welcome in this. So we need to make ourselves visible.
So the one thing I will say to that is the thing that I've done, and I'll share this because I've never shared this with anybody else.
Okay, 30 seconds.
This won't take long at all. I was trying to get into medical school, and just like Randy talked about, the path wasn't the cleanest. And I had been told no once, and I had started to doubt myself. And I drove from my parents' house to the hospital that was near it, and it was late at night. I opened every window in the car and had the moonroof open on the car that I was driving, and I sat in the parking lot of this hospital and looked at it and said, I want to work there one day. And I did this for a week, just kept going back. I want to work at a place like this one day. And then my now wife said to me, oh, you should just give it one more try. And I was at the place where I was like, I don't really care anymore. I'm done. And I tried the one more time. Look where I'm sitting. Mm-hmm. So I'm saying this to say, you might not see a brown face. You might not see the success in front of you. Sometimes what you got to do is just imagine it. So what Don was talking about, sometimes it's how you dress. Look good, feel good, do good. Sometimes it's, seeing another person and saying, well, that person that's running that bakery is doing good, so I'm going to do good today. So sometimes it's literally just imagining your goal.
I agree with the point that you all made, by the way, but I agree with what Emil said about the visibility. The more I agree with the statement that the more Black male physicians that they see, most likely they can, I guess I can become a Black African American physician. But to kind of go with what the documentary was saying, Dr. Dale was saying, although I do get that at the early age, it needs to be instilled, but he's like, what about the now? What about we know there's 200 medical schools in the United States, approximately. We know every medical school don't have Black males in it. And is it legit that they're not applying? Or is it, he brought up an interesting point, Dr. Dale. He was like, just think about it. If every med school took in one African-American male every year, that's every 4 years, 200 Black men physicians are matriculating through. Do you know how powerful, if every 4 years, or let's say if they took two, that's 400 every 4 years of African-American male physicians, all aspects of specialties. You know how much giving back you can do, you know how much visibility you can do, you know how much it's mind-boggling. And I think he was going back with his brother. His brother was like, we got to start early. And he's like, yep, I agree. And that's kind of what the point we've been hitting on is, setting the bar high, persevering, knowing that you can do it. Parents always strive for excellence, but like what can be like right this minute. I mean, the
What
med
can we
school.
do?
I went to at one point my medical school in 2014 admitted one African American out of like 280. One out of like 200. I mean, that's the stuff that we have to try to come together. Like, how do we stop that? Because guess what happened? The next year, it was some things happened. The positions got changed. The next year, 36 African Americans were in the medical school. It's not rocket scientists. It's not Chinese arithmetic. But I do agree with Dr. Dell. It's like the med school should like have some type of that gateway in. I mean, it's hard to tell me that it's not that many qualified African American males, or I mean, even throw in females that are applying that don't just she don't qualify, GPA. And I think that's BS, honestly, that, oh, you don't have the highest GPA, or, I mean, we all know physicians, I mean, like Dr. Gray said, I didn't always have the highest grades or the highest MCAT, but I believe I'm a damn good physician. And my patients, I mean, I get my patients, the staff, everybody, you know, but that's a roadblock that we encounter.
You made some very good points. I agree with you wholeheartedly.
You get a low MCAT. Yeah. Oh, well, yeah, maybe you ain't
that.
cut out for this. And it's like, no, let's help him. Let's give him the resources he needs to increase his MCAT and look at his entire application. I mean, you know, set something up for him. Don't look at that and just brush it to the side. You might have just pushed away an orthopedic surgeon or a neurosurgeon. But once again, this goes back to all the things that I believe is the reason why we have this 2%. The educational disparities. You know, African Americans, we most likely get our education from schools that have less resources. The cost of medical school. I mean, a lot of us get financial aid, some of us don't, but the financial aid, then you get a refund, and I mean, that's either going towards rent or, I mean, I wasn't, my case, I wasn't fortunate enough to live with parents, and, you know, all my refund money had to go to rent, car note, car insurance, I mean, food, you know, and I mean, it's just multiple barriers that I think we face that, you know, you just, I mean, I'm trying to put it in, I
get it. And I understand what you're saying. I knew this was going to happen. We're close to the end, and I'm loving what you're saying, Dr. McPherson, and we're going to have a part 2. So I'm already drafting every one of you, because I didn't even hear enough from you, Dr. Gini. So we're going to have a part 2 of this, because I even think, you know, making this a part 2 or a series, the people that are listening now, tell your young people or tell your aspiring doctors to tune in, because sometimes they can just hear conversations like this, and that can be the tipping point to their success or desire to become a physician or anything, even if it isn't a doctor, just the desire to succeed. There were some questions in here that I wanted to get to, and I didn't get to those, but I do want to get to these books that we are going to raffle off. Jalen, are you ready? You can just type in the chat. She said, yeah, I'm surprised she even talked. All right, we are going to have her share the screen for raffling off. And the first book we're going to raffle off is How to Raise a Doctor by Dr. Dale. Can you see the book? So she has I was so excited. I'm not really technologically savvy. So she has the names on the spinning wheel, and she will spin the wheel now, and we will see who has the book. Ready? Go. Look at that. Everybody know of this? And then Chris, oh, you are the winner. If you are here, please just type in the chat that you're here and you won the book. We'll give you a few seconds. And Jalen, take that name down, because I have another book here. Let's roll it again. And this will be, if you have a child in your life, it's going to be Doc to Doc. Tony and Jace learn about the virus. So this is about the virus. I don't know if you can see it while I'm holding it up. Looks like it is Isabella T. Please type in the chat that you are present if you are here. Okay. The person who says they're here, I don't know if you're Isabella, because who it says it's from is neither of those names, but. Okay, we're gonna spin the wheel again. This one is Learning About the Lungs, Dr. Doc, another children's book. We'll spin the wheel.
Esther is just saying that she's Christ. Oh,
Who is?
Esther Okoye.
Esther, okay.
Email, who's that?
Denise. If you're here, type in the chat, you're here. Mary, if you're listening, you are listening. Can you get those names down of the people who are typing in the chat, please?
Yes, happy to do that.
Thank you. Okay.
Isabella T is also there.
All right, we have another How to Raise a Doctor book by Dr. Dale. We're going to spin the wheel again. Jalen. Why is it so dragging? Oh, I know you're here. If you were still here, you typed a couple of questions in the chat. That Beza. Okay. Just type that you're here, please. Yep, you're here.
I am so here.
Look at that. Who said that?
Beza.
Oh, I see it. Okay, and then this is the last one. It's one of the children's books, Doc to Doc, and this is about learning about the heart. Catherine T, are you here? Just type in the chat that you're here if you're here. You must be present to win because we can't track you down. Going once, Catherine. Catherine T here. Okay, I have it. You're all here. So in order to get your book, just email me, g.anderson@novilibrary.org. And we can make arrangements for you to get the book. You can pick it up at the Novi Public Library, or we can find a way to get it to you. Thank you. Wasn't that fun? You can stop sharing your screen, Jalen. Thank you. That's my daughter.
That's all.
Did I mention that? See how you're proud when you have your kids, don't think? You know what? I want to close it out with just, we're a little bit over, but I want Dr. Gray to just say a few closing remarks. I wanted everybody to, but we don't have enough time. You're going to do a part 2. I've already committed you to that. But just however you'd like to end this, Dr. Gray, with either inspiring words or just something.
Or just something.
Something.
No, I'm just really privileged and proud to be part of this panel. You know, just looking at these faces staring back at me, you know, this is the future of medicine, the next generation of providers and physicians. And, you know, they all have, you know, pretty unique stories. Each one is different. And we all have, you know, terribly common stories. You know, we have a shared legacy, a shared history, a shared experience as African Americans that you know, colors our experience. But first and foremost, you know, these are outstanding physicians that we're looking at here, and the country deserves more like this. And I would just encourage the audience, whether they have children or not, whether their children are grown or not, to take a personal interest in this subject. There's not a simple answer. You know, in the film, Dale and his brother, you know, sort of argue back and forth as to whether or not as Randall sort of alluded to, whether or not the solution was, you know, big picture solution or whether it was individual responsibility. And of course, the answer is yes. It's all of the above. Everyone can talk about this. This should be a priority of federal health policy. You know, disparities are only, you know, being illuminated now because of this dreadful disease that we're experiencing, but they've been there since the beginning of our country. And we need to take steps to ensure that we have doctors that look like the patients they take care of. Compliance is better with medical recommendations if the physician looks like comes from the same community as the patient. Patients are more trusting of doctors who they believe are acting in their own self-interest and who they can relate to. Children see doctors and dream and believe that they can be doctors. There's all kinds of compelling societal reasons, not just our own individual selfish success stories, but there's all kinds of reasons for why our country benefits from a group of people like this. And so I'm proud and pleased to be here, and thank you, Gail, for and the Novi Public Library for organizing this. Really appreciate it.
Thank you, Dr. Gray. Much appreciated that you agreed to take out your time to spend to share your wisdom with us. I appreciate it very much. And thank you to all of the young doctors. I encourage you, as you encourage others, to keep holding on, keep working towards your goals, because this is not it for you. You're a doctor and that is not it. There's much more that lies ahead for you. And then you still have lives to impact. And I hope that inspires you as well. When you hit those depressing and sad moments, just think about what lies ahead is better than what was behind. And thank you very much for agreeing to take out time to spend with me in the Novi Public Library. And I'm holding you to it. Everyone raise your hand. You're coming back again, part 2.
Glad to talk to my lawyer.
There you go. Okay. And for those of you who did not win a book and you still could be interested, it's what's it called? How to Raise a Doctor by Dr. Dale. You can visit the Novi Public Library and check out the book, or I think you can go online and order it as well if you'd like to purchase it. Some inspirational words in there as well. So thank you very much for joining us this evening. I appreciate it very much, and have a good night. If you'd like to see the film, if you still like to see the film, you can email me and I can send you the link. You have until I think midnight tonight. You can still see it. It's an hour and 20 minutes long. GAnderson@novilibrary.org, and I can send you the link. Thank you all.
Before we go, Ms. Anderson,
Yes.
I think I speak for all of us when I say thank you from all of us, because having someone like you that puts us on a platform like this where we actually do get to share our experiences is not something that gets done often. So having someone like you that celebrated us, I mean, I can speak for myself when I tell you that when I talked about the people that you meet in your life that give you the boost, it's things like this that give you that boost. So thank you for giving us this platform to actually share our experiences and maybe, reach one, teach one, reach back and help someone, which is what all of us are trying to do in this job.
Thank you so much.
Yeah,
That's so
absolutely.
sweet. Thank you. I appreciate it. Good night, everybody.
Good night.
Good night.
Good night.
Doctor, stay on.